Oh.
Here we are.
Okay, you're all set.
Okay,
Excuse me.
all right, so we'll go ahead and get started and please feel free to join us at the table. You have plenty of room tonight and someone can put a chair up here if they want to. All right. Yeah, we're low on people, even online tonight, so well, we'll just go ahead and power through. And I'll start with introductions. I'm Elise Schweitzer, Chair of the Board.
Hi, I'm Anna Tamas. I'm a psychologist here in the community who works with children and teenagers, and I'm not fully approved yet to be here, but I was glad to be able to be a participant tonight.
Sally McConnell Janae. I'm retired from Cornell and I'm the mother of a mentally ill person and the grandmother of 3 people with serious mental health issues. And that's what drew me to this board.
I'm Kathy Wonderlick. I'm also sort of approved by this, but not yet all the legislative stuff, but I depend on Randy to make sure that that happens.
I'll give it a shot. I'm Randy Brown. I was appointed by the legislature in February election.
Jessica Connor, a member of the Community Services Board and member of the Mental Health Subcommittee.
I'm Howard Reed. I'm a prospective member, hopeful member. I'm Frank Krupa. I'm the commissioner.
Harmony Ayers Friedlander, Deputy Commissioner, Director of Community Services.
Sheila McHenry, member of the board as well as DD subcommittee.
I'm Mary Hutchins, member of the board here and a member of the mental health subcommittee. I should also mention that Nicole Zulu let me know that she wasn't able to attend tonight, but she'll be back.
Jan Lynch, member of the CSB. Okay, and we still have no one online. Oh, Larry joined. He's in the waiting room. Hi, Larry, are you with us?
I got 2 of them, so I'll
Okay.
find it interesting.
Hi, Larry. Can you hear us? He doesn't appear to.
He moved.
Wasn't just.
Larry, can you hear us?
Okay, so
He looks frozen.
maybe whoever has the power can just type in the chat to Larry.
He looks frozen or dead. So
But you know, that
we'll assume frozen.
moved a little bit, doesn't appear. to-
Yeah, yeah, he did, because I wondered that too, and then I saw him move.
Oh, so you could
He's
probably put a chair
talking now.
over here if you want.
We can't hear you, Larry.
Okay, so we'll move on without Larry for now, but Larry is also a member of the board and chair of the mental health subcommittee.
We have 4 on 7. We need 8.
don't think so.
Well, Larry counts in quorum, so so if it is a disability accommodation, it counts for.
The clerk of the legislature, I checked with that and they have not made any changes to the rules at the county legislature level. So they were not aware of anything related to that. And so I was instructed that they are not to be considered in person.
Don't they have to comply with state law?
I was gonna say, are they aware of human rights law and the ADA?
Yeah.
I'm just telling you what I was told by the clerk of the legislature. I very specifically asked the question after the last meeting because we were trying to figure it out. If you have references to law that I can send to them, I would gladly do that.
I have it. Okay. Send law to Frank. I remember doing some digging on this a while back, but I'll have to look for it.
Yeah, I
You have information, Jan.
do I have what?
Did you have information too? I thought at one point you had.
Well, I did, but it was most, I could find it. Mostly verbal.
Have it somewhere. I'll dig it up and I'll find it. It's on the state website.
Do we have
Find it.
14 or 15 board members?
That's a good question.
15, we have over.
There's 15 total. We need for quorum.
Yeah.
And we have.
Even the people.
Larry,
Larry, we can hear you now. We're just doing introductions.
15, do
You can go ahead and introduce yourself.
Well, I'm Larry Roberts. I'm a member of the Community Services Board and the chair of the Mental Health Subcommittee. We just got power back here, so I'm a little,
Oh, yeah.
Lights were out. Yeah.
Yeah, it's been a long day. And Stu, do you want to introduce yourself?
Hi, I'm Stu Bergman. I'm a member of the board and also on the substance committee.
Okay. Well, we will have a deletion to the agenda. Unfortunately, Josephine Gibson is not well today, so she is not able to join us. So we won't have a presentation from the Mental Health Association today. Any other additions or deletions to the agenda? Okay. Minutes from September. Did we establish? We don't. Okay, so we'll have to table the minutes until November.
Bob shows up.
Yeah, if someone shows up, we can do it later. Privilege of the floor. Any questions or comments from boards or guests? Yes.
I'm just not very put together thought yet, but our local YMCA had a brief grant from the Tompkins County Youth Services Department to offer free swim classes for children with developmental disabilities. The grant has since ended, so I am working with their team to locate other areas of fundings such that the developmental disabilities kiddos can get access to free swim classes because we live in town and
Yeah, they had it for years.
they did, yeah.
So my son is one of the instructors. It's a magical experience.
Yeah, so I put that out on people's radar and that so my wife is one of the instructors, and so I have a financial tie to it, but I would suggest us promoting. I think it is a good idea for kids in Tompkins County with developmental disabilities to have access to.
Where was?
It was from the Youth Services Department under very specifically under the gambling money. The money that the county got for.
Yeah, so when the casinos opened, there was gambling funding that every county received. I'm not familiar with what you're specifically talking about, but
Tiny grant. I don't think this is gonna be, so anyway.
There's also, so the high school has this brand new pool. So there's such a huge need, there's this facility now that is not being utilized by the community in ways that it could be too. So there is more space available now. So.
Well, the YMCA has a really long and good history of working collaboratively with the Racker Centers as well to run. And I ran a recreation program through the Racker Centers there years ago. So I don't know if anyone's explored partnership with the Racker Centers to be able to make that happen, because they have waiver respite and other respite dollars and family support dollars. And
Right, and we just have to.
collaboratively, they might be able.
Developmental disabilities support in the county.
So I would reach out to Family Support Coordination Services at Racker Centers.
I'm also gonna reach out to our foundation and back out to
We
the.
used to do overnights there for kids with disabilities and all sorts of programming there at the Racker Centers.
that's what Brandon does.
Yeah.
And they could definitely use more lifeguard, more instructors, so more high school students.
I know, yeah.
So that money could be used that way too, because the lifeguard classes are expensive.
Yeah, that's a problem everywhere right now, Jackie.
The other thing to look at is that you've got the short-term issue, but on a 3-year grant schedule, the Youth Services Department funds with county money and state money programs that right now, none of them are YMCA. Not sure YMCA is eligible for it. I think they would be. I don't know why they wouldn't be. 501c3. Yeah, but that would be potentially, we're just starting the second year. Next year will be the
Okay.
second year of a 3-year cycle. So,
Yeah.
so you've got 2 years, but then they might want to be paying attention to that. And when that RFP goes out again, that could be potentially longer term funding for them.
Thank you.
And this tends to roll over if, as long as the programs are successful,
right.
things.
And this might be a reach, I don't know. You could maybe check IPI, that, Public Education Initiatives, Ithaca City School District.
Yeah, and I'm in talks with the medical director at Ithaca City School District about it as well. And with, looking into BOCES a little bit too, so.
Do you know how much the funding is?
I think they'll just need like 5 to 50,000 a year.
5 to 50? It's a big range.
Just talking to them about
Okay.
yesterday.
Just making sure I heard you correctly.
I just started yesterday. I don't know.
No problem.
Something I want to figure out.
Wanna say something? Larry, go ahead.
So, there's been a swimming program for kids with disabilities in this county for at least 60 years. So somehow, we should be able to find a way to fund it. I mean, there's lots of people over the years who've been involved with a swim program. So I'm pretty confident that something can be found. I mean, I'm a alumnus of a swimming program that was run by Ithaca College. So,
I know, it just seems absurd that right now they're saying that families are gonna have to pay like $50 a class for it, which seems silly.
Cheaper.
I don't know that those are.
I could also reach out to SUNY Cortland because they have an adaptive PE program that's really good. And they sometimes do like credit bearing opportunities for their students in their adaptive PE students to come and do work in the communities. You might have some.
So yeah, like I said, I'm at the very beginning stages of figuring this out. I just found out that they were gonna start charging families and I thought, well, that seems silly because this seems like a thing that we should be able to.
Yeah.
Someone should want to financially support.
At least not $50 a class or like
Yeah, really.
exorbitant.
Yeah.
I'm not sure this is the right area for this, but I know that you mentioned about disabilities requirements for children and youth and what there's laws of minimum things we need to provide. Is that where, does this come from this group or was that comes from someplace else? Who could tell us what those things are?
Okay, so I think, are you referencing the conversation that we had about access to activities for children with disabilities
Yeah.
in relation to summer camps? So yes, and it's a lot. So we couldn't get into it all here, but there are nuances to the law. But yes, kids with disabilities should have access to swimming lessons at the YMCA, period, right? And so then there's all of the detail that, has to get worked through around that. And sometimes what comes up is the concept of direct threat. Under the ADA, sometimes it's misapplied and people think that kids are in danger or they apply special restrictions to kids with disabilities unnecessarily. So there's like a lot to unpack there. The whole
Liability.
yeah, like they might think they have a liability of reason, but they don't. It's no different than teaching any other kid who doesn't know how to swim in terms of liability. But yeah, so there's always usually a lot of unfounded concerns, although the YMCA is not that place.
No, I think
Actually, so yeah, but yes, yes, they should have access to swim lessons, period. But I think this was sort of an adaptive program that was kind of special. And so,
That's fun.
Thank you, everyone.
yeah, all right. Anything else? Would anyone like to add anything else? Before we dig into the agenda?
Oh,
Yes.
Okay, any other correspondence or announcements? Okay, chair's report. I don't really have anything in particular to report. I think the work that we have to do tonight is now around the extensive work of the nominating committee over the last few weeks. There have been a lot of applications whizzing around a lot of good applications for subcommittees as well. And so I think we have a few of those things to talk through. The only other thing I was going to let everyone know, I can't remember if I've said this here or not yet, but I'll be leaving the CSB after the end of December. So someone else will step in his chair, and then I'm going to actually just step off the board altogether. So I just have a few things coming up professionally and personally that are going to make it a little bit more difficult for me to engage. So I'm sorry about that, but just wanted to let everyone know.
And we've appreciated you while you're here.
Yeah.
Absolutely.
Well, you never know. I may apply again someday when things settle down. So.
Can we approve minutes?
Oh, yes.
Yeah.
Yep. Let's go back and do that. So if everyone wants to take a minute and look at the September minutes, if you haven't already.
Yeah, look, that's on. I'll make a motion to approve the September minute.
Seconded. Any other discussion about the minutes? Do you have something, Jan?
No, I don't.
Okay.
Sorry, I was thinking of some different minutes. Sorry.
All in favor of approving the minutes from September as written? Aye, raise your hand. Anyone opposed? Okay, minutes are passed.
They also have July, don't we?
Do we?
Yeah,
Is it in the
July
packet?
is-
I didn't see it on the agenda. Sorry about that.
Yeah, it wasn't on the agenda.
Okay, so maybe everyone needs a moment to refresh themselves on the July minutes. Okay, anyone ready? Motion to approve the minutes as written? Sure.
Second.
Let's do seconds. Okay, all in favor of approving the July minutes? July minutes are approved. Okay, we'll move on to commissioners' report. Frank.
So just two quick things. One, budget process is underway. I think we talked a bit about this last time. Thursday evening, there is a budget presentation for the public. I think the county administrator is going to be doing a presentation. The public's welcome to provide input. And then next week, the legislature will begin their voting sessions for adding or removing things from the county administrator's budget. I believe I told you we had 5 OTRs, 4 of which are included in the county administrator's budget, the continuation of the CARES team, the continuation of funding for the Alcohol and Drug Council for 1 more year, continuation of funding for REACH for 1 more year, and vehicle replacement OTR, which is more an administrative thing than really an OTR. The one that didn't get included and has not yet been, that I'm aware of, brought forward by a legislator, is to fund the expanded community outreach worker program, which Family and Children's and Harmony worked to get a grant for a year to expand that program to the rest of Tompkins County. So far that is not included in the county's budget. Or as far as I know, been brought forward as an amendment to the county budget to be added. So that's kind of where we stand on the budget front. With that, a lot of competing priorities, as you can imagine. So the legislature's got their hands full, it's for sure. We did bring on some new social workers recently. So the same work that has kind of garnered our new members of the board and subcommittees has also helped get some candidates into the pool. Harmony, Jeremy, and others have worked to make it a little bit easier to bring social workers on for us. We do actually have a 1-year period and a new program that the governor has formed that does not require a written exam for the licensed clinical therapist test. So we've advertised that. That has helped. We also have loan forgiveness, which we've had for a while, and Harmony worked with HR to adjust our job description. So we were able to bring on newly graduated students immediately upon graduation before they have their license in place, which have been a barrier for us. So I think all of those things in combination have helped. So we're onboarding those folks as we speak, and hope that that will help us, particularly with children and youth, because that's what those positions are focusing on. So a little bit of good news on hiring front, and we're hopeful that that will continue. Go forward. That's all that I have.
Frank, anything we can do to advocate for the outreach worker to be added into the budget? Go to the meeting on the 5th?
Yes, the meeting on Thursday is one place. Certainly, talking to your legislators. If you have one in the district that you live in, you live in the county, you can talk to any of them. But really it will take someone making an amendment to the budget to include it before it would even be considered by the legislature.
Anything new on hiring an administrator for the ACPs? The Alcohol Council?
Hiring what?
The executive director?
Oh, no, I don't. I don't have any update on that. I know the Alcohol and Drug Council is looking at many different potentials for their future as they move forward right now, but nothing to announce yet.
Any questions for Frank? Larry? Muted.
Larry, you're on mute.
So two things. One, we could ask Randy to forward the OTR, could add the OTR. And two, Frank or Harmony, if we've hired people who are right out of graduating and haven't, whatever the governor allows, does that imply a different level of supervision that the department's going to have to provide to them?
Yeah, for a short period of time until their license is in place. And they won't be able to provide all of the same level of service. But what it does allow us to do is to hire interns that interned with us. Because as you can imagine, upon graduation, they want to know they have a job. And so they're looking during their internship for that job, and we were not able to offer it to them. But this allows us to do that. In fact, we have some folks graduating in December. I think that we're hopeful we're going to be able to bring on as well. So it's really more about us being able to benefit from the effort that we put into allowing interns to come be a part of our program that we didn't have before.
And Larry, they have to get what's called their limited permit. They can't just, so there is some paperwork, and New York State Department of Ed has to approve them. So it's still pretty highly regulated.
Okay.
Any other questions? Larry? Okay, thanks, Larry. Harmony.
So we had a really successful event with the Suicide Prevention Coalition on September 28th. It was called How Healthcare Prevents Suicide. We held it at GIAC. It's from 5:30 to 7 p.m. There was a number of agencies that tabled for the first half hour, and then we had two panels. The first was on zero suicide, and we had a number of healthcare representatives from Cayuga Medical, from Guthrie, from our own clinic, and from Alcohol and Drug Council, or maybe it was CARS. We had a number of healthcare representatives who talked about how our county has an initiative where all the healthcare providers come together and they meet regularly to talk about how to implement this model, because it's the best practice in healthcare. And so by getting together, they learn more about how to implement the model. They sort of hold each other accountable to implementation, and they go through all the steps with some support. And then the second panel discussion was around suicide as a public health problem. So it was a really nice event. It was sponsored by the Sophie Fund as well as held by the Suicide Prevention Coalition. One of the things that the Suicide Prevention Coalition has done is broken down into work groups. You can find the strategic plan for the coalition on our website, and each work group also had a poster that was really professionally and beautifully done that explained the work that they've been doing. There's been some work on means restriction, making sure people were able to get access to gun locks, organizing educational and training opportunities for every school level, K through 12, and then the college level, different activities. We're really trying to take all the resources that are available in the community and put it in an organized way. And then there's a data group as well as the Zero Suicide Work Group. So all of that information is provided to the community. I wanted to let you know that we were able, Frank was able to find a way for us to get a fellow to work in on the mental health side of things. So we were able to get Ross Milne. He has a master's in public health with a focus on community-oriented practice. He comes very well experienced in doing large collaborative projects. He worked previously with school districts on how to organize their COVID response. So you can imagine how detailed that kind of work was. He has experience in data analysis and project management. So he's going to be really taking the lead and helping us organize that funding initiative through the opioid dollars that are coming through the LGU. So he'll help write a request for proposals. Remember, that is a model that will include some sort of emergency housing for people who are identified as having serious mental health and substance use needs. And it will include some wraparound case management, intensive case management supports for people for a short period of time until we can get them to go through the SPO process or some other avenue for them to get more secure housing in the future. So it's really for those who are at very high crisis, very high risk in our community to make sure that somebody's really supporting them. And referrals will be made through our crisis intervention team that's held at the hospital. They hold a meeting every month. They have law enforcement there. They have people from the shelter. They have DSS there. And they talk about who's the most at needs in our community. What can we do to help support them? So they'll come through that. Referrals will come through that system there. So he's going to help design that. So we're really excited to have him. He started about a week and a half ago, and he's already met with a lot of people and learning a lot.
That's wonderful. Is he also the fellow who's assigned to the Zero Suicide?
No, we have another fellow that's working for me that's doing that work, Frankie Pirtle. And she's working with Zoe. So Zoe moved into a full-time position with us and vacated her fellow role, and we've recruited Frankie in to fill that. So the two of them are working closely on those initiatives.
Well, it's really nice to have. We had a lot of really good candidates, so it's made it fun. And the other thing that Ross will be doing is working on domestic terrorism activities. Every county in New York State, after the horrific deaths and shooting in Buffalo, was required to create some sort of domestic terrorism task force. And part of that is also figuring out, well, okay, if someone identifies a high risk person in our community, how are we going to respond? And when you think about where a lot of these incidents have occurred, they've been in schools. So given his experience working in schools, figuring out a way to help support education, school districts and responding to students who may have very, very high needs and our red flags, like what's that protocol going to look like moving forward, and we're hoping to develop a comprehensive protocol for that. And so he'll be perfectly suited for that piece of the work. There's a parade of quilts that's happening tomorrow, and it's going to be at Kendall at Ithaca from 7 to 9 p.m. This is a really beautiful event where 50 people in our community who are quilters have made quilts, and they're going to be used as the bedspreads at Alcohol and Drug Council's new facility on Trip Hammer Road. Many of them will be talking about the quilts will come out. I'm going to be holding a quilt. Thank you, Frank. And I think it's going to be a great event. While you hold the quilt, the person who's designed it will explain a little bit about how they designed it. And they may also talk a little bit about the history of why they made the quilts. So I think it's going to be a very moving event. So if you're interested, I think that might be something you'd want to attend. I also have some brochures for you. The one is on naloxone and or Narcan, and the other is on fentanyl and xylazine strips. We're really improving. Part of what I think you learned when you were doing the opioid task force is there were a number of people in the community who really needed access to Narcan, xylazine, and fentanyl strips, but it wasn't necessarily something we wanted to have the dollars from the opioid settlement fund go towards. It was something we could do a lot more of that work at the local level and preserve those dollars for other kinds of activities. So a lot of work went into the design of these brochures, and you'll see they're from Whole Health. We're giving out kits. We are able to provide a lot of training to agencies in the community, and we're partnering with Alcohol and Drug Council on doing that training as well, because they're also a designated site. But we're also giving out a lot more of the Narcan, fentanyl, and xylazine to people in the community. People can walk in to buildings and get it. On the community health workers over in the Brown Road location are now have just gotten trained, and they're able to give out these kits as well. So in each kit, people get the strips. Fentanyl and xylazine are both things that can be added to heroin and can be deadly. So these brochures explain how to use the strips so you can test your drugs. And then also each packet, each kit we've put together has 4 Narcans in it at one time, because now it is so strong. If it's got the fentanyl added in, then often you need more than one administration. 4 may not be enough, but hopefully you can get medical personnel there. And one of the things you'll notice on the Narcan brochure that I wanted you to be aware of is if a person decides to use, they don't have to use alone. There is somewhere on here, I'm trying to find it. There's one of the links where you can find somebody, you can contact them, and they will stay on the phone with you while you're using. It's on the bottom, right? So
It's at the top.
it's at the top, never use alone. If you go to this phone number, it's a 1-800 number, and people can also use the QR code, and they can learn more about it. And it's really a wonderful program where somebody will stay on the phone with the person while they're using. And then if they don't keep talking to the person, they send medical assistance to them. So there's a lot of information about 988. So now on our website, it talks about 988, and underneath it, it also talks about how to get assistance for Narcan. So there, when people go, they can find all that information. I forgot to mention one of the really cool things that happened at the Zero Suicide event was that a packet was put together for the public, and now that's been posted on our website. And in that packet is information on how a person can identify the red flags for suicide in a friend or a neighbor or a loved one. And then also how they can assess using a Columbia Suicide Severity Rating Scale that many healthcare professionals use. It's a simplified version with instructions so that anybody in the community can use that to assess the level of risk somebody's in. And then you combine that with information about 988. You have like, how do you see the red flags? How do you ask and have the conversation with somebody? And then who do you call for help? All on our website. So it's really, I think, great that that's all out there. And also there's all the information about substance use, because they really are connected and how to stop overdose. And one piece of bad news, Randy reached out recently about the possibility of a closure of an OPWDD program through the state. And I was well supported by James Beaumont and Jeff Boyles, who attended a virtual session with people from OPWDD at the state level to talk about is there really a closure that's happening? And there is a closure at the Abbott Road OPWDD's location. So that's a state program. I misspoke. It's not called a closure. It's called a temporarily suspended. So by law, if they were closing the program, they would have had to notify us, but because it's a temporary suspension, they did not notify us. But in the course of that conversation with them, it was learned that there was a December 2019 suspension of the Peruville site, July 2020, the Pinckney site, the Pinckney location, December 2021, the Aurora, and now November 1st, they'll be closing the Abbott Road, and combine that with 2 closures of programs at Racker and 2 closures at Unity House. There's about 50 beds less now in our community for people in the OPWDD system, and it is all related to lack of staffing. And we're in the Broome region, and they said of all of the locations in Broome, in that region, we are the hardest to staff. And we know that a lot of that's related to cost of living. I did ask that in the future, they really communicate with us more closely, even though they're saying these are suspensions, we really want to get them started up again. We're looking at maybe should we combine different programs? What they're looking at, like, where's the population centers, and should they try and put places in the more of a population center? What's the quality of the building? Do we want to maintain this site as reasons where they're going to try and reestablish programs again? But you know, once something gets closed, it's not a good sign that you're ever going to get it back going again. So suspended. But they do really want to do that, and they know that there's a need here. And they know that it does create challenges for some of the people that are moving, and everyone that is in one of those programs should have a care it's OPWD, so they use care manager, not care coordinator. Care manager that should be supporting them around how to meet some of their transportation needs and some of their service needs. Because for some people, they've been here for a really long time. So it's not just a transportation challenge potentially for their family members. It can also be a loss of service providers that they've had for a number of years, and connections and friendships. And so it's a really difficult thing that obviously nobody wants to have happen. So just to keep that in your awareness, it's the same thing we've seen like in RTFs for children and other kinds of programs right across the state. And it really is related to, finding people that are willing to do this kind of work at the salaries that they're, even though they've improved FAT and they've done a lot to try and improve it, just hasn't kept pace with what's happening in the private sector.
Yeah, I have a couple of thoughts, and I'll go to you, Jessica. So first of all, a lot of the properties you mentioned were vacated several years ago. So did you find out, do they actually still own those properties? So they've just been vacant properties?
Suspended. They're not. They still have those. All are considered suspended. So they're all theirs. Yeah.
But they didn't liquidate the actual properties.
Because they're thinking they think they might combine some, but they really want to look at the properties that make the most sense in terms of like maybe they said that this Abbott Road one, they were sending people from Broome County almost every day to staff it.
Right.
And they said, given like the healthcare risk, like if some of your staff got sick, or if it was a bad snowstorm, that for safety reasons, they just didn't feel like they could keep doing that.
Right. And I think this just goes back to the conversation we've been having for a number of years around direct support workforce in Tompkins County. And a lot of us have been saying for years that it's going to be a crisis. And I think a loss of 50 beds, even if it's not a real loss, it's just an on paper loss of 50 beds for people with developmental disabilities in a county where we are in a state where we already have so much of a wait list for those types of services that were actually out of compliance with the Olmstead decision of 1999. And there are several lawsuits pending against the state. I think in Western New York, there was a group of parents that were going to sue the state because they're out of compliance with making sure that people with disabilities can be cared for and served in the least restrictive environment. And I know this came up in a meeting of the Most Integrated Settings Coordinating Council at the state level a couple of weeks ago, where, leaders at the state level, like Harvey Rosenthal, and a couple of other folks are starting to get really vocal with the state about this. But I think it's really long past time that the county take some type of action on the workforce crisis with direct support, because Ithaca is not getting cheaper. We are getting more expensive. We are building more and more luxury apartments that no one can afford to live in, except for kids whose parents live in New Jersey and pay for it. And so I don't see this getting any better. I see it getting worse. And I know that it's a problem across the country, and I'm wondering if the county might be able to do something like form yet another task force, but some type of investigative body where you can begin to explore what have communities around the country done to solve this problem. Have there been any other innovative things that have gone on? Ultimately, there's got to be money for salaries, but there may be other ways around it, like housing subsidies or preferential housing units that are, we're giving a lot of tax breaks to a lot of developers in this community, and I'm not sure what we're getting back for it. And maybe, we ask for things like set aside housing for direct support workers or something.
Did you talk to Corinne? Because as Corinne's ideas in the city, unions used to do that for their workers, this kind of housing.
A lot of universities are doing it for new faculty because they can't afford to live where the
Right.
universities are.
And so there's, I think the casino, was it Del Lago or one of the casinos nearby built housing for their casino workers because they had the same problem. The people who worked at the casino couldn't afford to live in the communities, so they built housing for them. And I think that although I want casino workers to have good housing too, I think that people who do this type of work especially deserve stability in salaries and housing. And all we've done is, and I, include myself in this, but all we've done is admire the problem for the past going on a decade. And I think something has to be done. Sorry, Jessica and then Gian.
2 questions. One, at what level of legislation, or I don't know, who decides the salaries of OPWDD support staff? Open question.
The rates are mostly set by Medicaid. So what happened, many years ago was the waiverization of all of these services, including residential services. And so they're kind of locked at the federal level. However, other states have done a better job at subsidizing the amount of money that goes into supporting those services so that agencies can pay a livable wage. So there are other states, and I think I've used the example before. I have a niece and nephew in South Dakota, and they do human services work. And their starting rate is somewhere around $20 an hour. And where they live in South Dakota, the cost of living is well below the cost of living here. So their wage actually has even more value there. So there are, gosh, if Kristi Noem can do it, can we not do it in New York State? So there are workarounds, and I just think it might be helpful to form some type of committee to explore the problem so that we can first understand it and then look to see who's started to solve it.
And a second, probably quicker question. I know there was some efforts underfoot in terms of getting Narcan available at our school districts. I'm assuming that we, at this point, still are not at a point where we can give out Narcan at the schools.
My guess is that's a school district specific question. And I would imagine they could become volunteers if they wanted to and get Narcan free from the state, but it would be up to the district to. We don't do anything in schools unless we're invited. Because we have to be invited.
But it would be good to know, is there a way for the student populations at the high schools to know where they can go and get this? Where can they see this information? Is there a way to give information about the websites to promote it somehow to teens?
So all of that has to be approved through the school district.
Okay.
So we can't just hand out information on a school campus or even give it to the school nurses. The districts have to approve that. We are working with them on several issues. I will tell you, Narcan has not been one that they've been jumping at.
Right.
that perspective, if you're aware of a district that's interested, we're certainly willing.
Well, I think this is one of the reasons why school district and BOCES representation is so important on the subcommittees, and it's been lacking for a long time. So that's one of the things we've been working on with the subcommittees is getting
Just,
those folks reconnected. So they
the
can-
kids just need to know where they can go to get their own information. So just somehow embedding it somewhere.
I'll talk to Brandy Remington at BOCES because she emailed me today about a vaping initiative they're working on. And I think TST BOCES was connected with Alcohol and Drug Council in terms of some other marketing around marijuana use. So I'll talk with her to see
They're
about.
both our prevention
The prevention
providers,
providers.
so that's why. They work.
BOCES and ADC.
Jan, do you have your hand up?
All I wanted to do was kind of put a face to this situation because it first came up because a father called me because his son that was 40 years old had been living in that house since he was 18. And the parents bring him home every Friday night and take him back every Monday morning. And they're going to move him to Johnson City, and the parents being older now are concerned that they won't even be able to go pick him up for the weekend. And, it's a long drive. It's like 4 hours total over 4 days. So I just wanted to say that because I think it really brings it home, like how it really affects people when these kinds of things happen. And it's no one in particular's fault, but we certainly need to do something different at this point. It's been going on for so long, and I'm sure there's a million stories like that.
At the Most Integrated Settings Coordinating Council meeting last month, there was a peer advocate who came to the meeting during public comment. And she came to express that she had been trying to advocate for friends of hers that were housed in nursing homes outside of New York State, who had been enlisting her help as a peer advocate to try to get them moved back into New York State because they were separated from family and friends and church and all the things that they wanted to be near. So I think it's a very human story. There's a lot of tragedy wrapped up in group homes closing, and residential options being limited, not, including the fact that people are often put in nursing homes when they really shouldn't be. Larry? You're muted.
Good, Larry.
So this is just another example of New York State's lousy history of dealing with people with developmental disabilities. I mean, we're the state that started the whole move people into the community because of Willowbrook and the scandal of Willowbrook. And the state doesn't seem to be able to learn any lessons about how to do this. And so I agree with Elise that we should really be trying to talk about ways to solve this problem about getting enough people to staff group homes. Not that group homes are, a great example, because we all know there are problems at group homes, but if we can't even staff them and people are going to nursing homes and New York State continues to fail the very people that we're supposed to be serving.
Yeah. Stu?
Yeah, I remember, Larry, just brought back the memories of, was it Stony Brook? No, something Brook. Willowbrook. Yeah, watching Geraldo Rivera uncover that and what changes took place since then. But I don't know what has happened, but kind of the watchdog effect of letting it slip away, it seems obvious, particularly when hearing the story from Jan. My question though was talking about getting out the Narcan. I know where to get those. I have tons of those in my office, but they stopped giving out free COVID testing as well as the insurance stopped paying for that. So maybe question down there for where do we still get free COVID tests?
So you can order 4 test kits from the federal government.
That's still.
We're doing that again. We are ordering test kits from the state and putting them out in the community. Most of the local libraries have them.
We have them.
As an option. So there's a lot of different community organizations that call us. We don't keep huge numbers in stock anymore. We wait until they're all gone and then we order more. So there might be a week or so delay on getting them that we didn't have before, just because we don't know what demand is and we don't want to have them hanging out and expiring. But they should still be readily available in the community.
Right. So I went up to the pharmacy and got my latest vaccination and they used to give them out there for free. And now the conflict they told me was they now sell them. So they can't sell them and give them out for free.
Randy?
Yeah, the same person called me and explained the problem with their son, and that's why I reached out for Harmony. So thank you for looking into that. Quite disappointing that the state has been doing that and telling anybody, but I guess that's it is what it is. It's really interesting to look at what the state will fund and what they're not funding. Because when you vote for people, they show you what their priorities are by where they're spending the money. It's pretty simple. But I would like, we had a presentation from Mr. Stallone, Martin Stallone, the CEO of Cuba Medical Services at one of our meetings, and they talked about the mental health beds that they have available at the hospital here. And correct me if I'm wrong about this, I think there was 6 for youth and 20 for adults. Is that
correct?
So right?
Yep.
And maybe you can get up to 8 youth or so, something like that. But they've been maxed out and they've been having to move, unfortunately, youth to other facilities. And so that's, that's where we are. Right? So where are they going? The other thing, we talked about what you just presented on the mental health support in the schools and how you've done these new things. I appreciate you doing that because it's hard to turn a semi truck around in a hallway, right? So thanks for doing that. One thing that and correct me again if I'm wrong, Frank, is it is really the schools that need to reach out to the health department, see what services they need. And we talked about, I think there'll be 6 therapists going into the schools with these latest hires, but it doesn't really cost the county a lot of money. The majority of the cost is covered by the state.
It's covered by revenue.
By revenue.
Yeah.
So, and I think to your point, the conversation of a task force or an effort, there's so many organizations that need people. I mean, it's all over the board. I mean, where isn't it, right? And I think that we do have an asset here at TC3 where they are doing some unique things, and we have workforce development things that are targeting areas. So I think your point's well taken. I think there needs to be a focus, understanding the state never gets rid of any real estate. They hang on to it and they close, and it stays closed forever, right? Look at the South Lansing Center and all those buildings up there have been sitting empty for how long? Us Willard, how long has that been sitting empty for 30 years? Or it's the state never gets. You go down to Binghamton, there's a whole village down there of mental health buildings that are just empty. So that's by design. It's where they vote their money. So I should get people see where people vote their money.
Well, and so theoretically, right, it should have been and was to a certain extent reinvested in community services. So when they closed the institution, they called it mental health reinvestment funds. And we still get some of that money and it gets sent out to agencies to do different work. But I think that there's not enough of it. And what happened was the pendulum swung too far so that now there's no acute care options for people. And that's on the mental health side of the coin. Like there are no acute care beds or intensive care beds for people when they need them throughout the state, because we did close all those institutions. But I would bet that the reinvestment dollars we're not equivalent to the amount of money that it costs to operate all those giant centers for all those years. So,
Plus,
yeah.
since then, there's been such a change in the cost of things. It's the same money coming in. It's ridiculous.
Right. Yeah, good point.
Well, and people always have this assumption that if you close down a big institution that's expensive, it's going to be cheaper to do it in the community.
Yeah.
And that's not usually true, because once you have everybody in one location, okay, you're paying for that facility, but you're staffing everybody there. Once you disperse staff all through a community and they have to drive places and go all these different places, that's pretty much as expensive, if not more. So it's not necessarily like, oh, just close the facility and it's going to save you a lot of money and you can make it community-based. Community-based may be better, but it's not necessarily going to be cheaper. So, and you're right, you don't usually get anywhere near the same amount of money.
Right.
Because there's sort of this belief that it should just be cheaper if you're not paying for that building. Right. There are a lot of other costs.
Yeah. That's good.
I did just want to put a quick clarification, Dr. Duplan, you know better than I, so you can correct me if I'm wrong, but my sense of things in terms of the child and adolescent inpatient side of things is that our local hospital can take the behavioral services unit goes down to age 13. And so, yes, 13 to 18-year-olds. And in my experience lately, I don't see many 13 to 18-year-olds being sent to other hospitals. Typically, there are not 100% of the time, but there usually are beds available. The people who I see get sent, who go into CMC and then get sent out for inpatient mental health care are the folks 12 and under who we cannot support in our hospital.
And who have always been sent out of county. I mean, they've always been sent to Elmira Psych or Syracuse or Binghamton historically.
So still a problem, but just a bit of a nuance there.
I just wanted to say one quick thing that's kind of ironic is that the DDPC, the Developmental Disabilities Planning, put out a documentary that I recently watched at a conference about Willowbrook, the lessons learned. So
Yeah.
people should watch it if you can. It's I think if you go to the website, find it.
Yeah. I was looking for it earlier today. I couldn't find it. I know
No.
they're screening it in New York City. All I could find is the
Right,
trailer.
yeah.
Or the-
It's good,
Yeah.
but I just find it kind of ironic that I think developmental disabilities silo has done the worst job of any silo of, I mean, that's just my opinion, but of really moving forward with the idea that you don't have to institutionalize people with developmental disabilities.
And Medicaid managed care is a cost savings initiative, period.
Right.
But it gets wrapped up in a person-centered bow, and it's not what it is. It's a cost savings.
Yeah, and
initiative.
it has like these care managers have like 300 people that they're working with. We've been told things like, you may as well help them with an application for services because they're never going to get it from their care manager, which is supposed to be their role.
That's one of the things that was brought up to Kim Hill, who's the Chief Disability Officer for New York State in the MISC meeting was nobody knows who their care manager is. This is a bureaucratic position. This is a paper pusher. That's all it is. It's so people used to have very intensive Medicaid case management when all these services were first waiverized, and they knew those people. And many times they had worked with them for most of their adult lives. And now there's no human touch to it whatsoever. So
Could we invite I think there are 3 agencies within Tompkins County who do the OPWDD care management. We invite them to come and
there's
Southern
get all of them.
Care Connect,
Southern Connect, Springbrook, Lifespan, right. And they all attend the DD subcommittee regularly, so they might be willing to come in and talk.
because I talked to the higher ups in 2 of them and expressed my concerns regarding the lack of responsiveness of the Tompkins County OPWDD care managers who work with children. And I've expressed this to one of the psychologists in Region 2 for OPWDD as well, just the lack of responsiveness of the OPWDD care managers. And I haven't had any kids who have worked with the third one, so I don't know what they're doing, but they don't have any kids lately, but.
Yeah, I mean, if people want to have that conversation, certainly invite them. They can describe, I think the general position that they take is that their care managers are well informed of service options and well connected to agencies here. And whether or not that is the way it plays out, it's hard to say, but I think if you want to invite them for a dialogue, we could reach out and see. I'm sure they would come.
We have Guthrie coming next.
Yeah.
No, we have Tammy Baker coming next month to talk about housing. And then Guthrie coming to talk about their zero suicide initiative the following month. We'll have to reschedule Josephine as well.
Yeah, no, my
So,
gosh.
side, well, we can certainly add that.
Maybe you can just put a pin in it for the new year, but then at some point you could schedule a dialogue with those care coordination organizations to talk about, I know that one of the common complaints from the DD subcommittee is that they are not fully informed always of service options in Tompkins County. So they're not appropriately connecting people to services in Tompkins County. That's one of the issues that's come up quite a bit.
And I think they've had a little turnover too, so
Yeah.
it comes down to,
And they actually do make a living wage, the care managers. That was one of the big selling points of the transition from MSCs to care managers, is that the care managers were going to make a lot more money than the MSCs made. But I don't know if that's worked for them. I mean, it's a for-profit model. So they're extracting that value from somewhere.
Well, the living wage is what, 16 and change. So it doesn't go a long way in Tompkins County.
Yeah, I think at the time, they were starting the care managers. It's somewhere in the 55,000 a year range salaried, which was an improvement.
stressful job, because if you're trying to refer people to programs that don't exist because they don't have any staff in it, then you feel that pressure too, right? Like if I can't really get the supports and services people really need and manage their care if those programs don't. And so I imagine there's a certain amount of just stress and burnout for people that do that. And there's a lot of paperwork where it used to be a lot more, you said, person-centered. People know the people that you worked with. So that probably gave a certain amount of work satisfaction that's not there now.
Yeah.
Yes, and I have yet to come across a care manager who can answer questions like, who is this patient, who's prescribing this patient's medications? What school district does this child go to? Who is their therapist? Who is their primary care office? Just very basic. Who are the people on this person's team? The care managers have not been able to answer those questions, which I have confirmed with their supervisors is a basic part of their function.
Yeah. Oh. A lot of holes in the system. We just examined several of them. Any other thoughts or questions on this topic before we go into executive session? All right, so hopefully the next time you all attend might be members. And then you get to stay.
Listen to
Really exciting executive session.
The motion.
Jackie knows that they're not.
Motion to go into executive.
Oh, sorry, yes. I get a second.
There you go.
Okay, Stu. Thank you.
These are beautiful.
Yeah, I got.
These are beautiful.
Aren't they beautiful?
Yeah.
Well,
They took at least 6 months to